My name is Jennifer Sandoval, Divisional Vice President of Blue Cross and Blue Shield of New Mexico, and I am the board chair for the Albuquerque American Heart Association. So ladies and gentlemen, why are we here today? My why has 4 names: Katie, Christy, Casey, and Kenzie, my 4 daughters. It is important to me to lead a healthy lifestyle so that I can be around to see them become healthy, productive, and successful women, and to watch their children and their children's children do the same. Community education and cardiovascular research is why I volunteer and support the American Heart Association, whose mission it is to build healthier lives free of cardiovascular diseases and stroke, which unfortunately remain our nation's number 1 and number 5 health threats. In 2004, the American Heart Association faced a challenge. Cardiovascular disease claimed the lives of nearly 500,000 American women each year, yet women were not paying attention. In fact, many even dismissed it as an older man's disease. To dispel the myths and raise awareness of heart disease and stroke as the number 1 killer of women, the American Heart Association created Go Red for Women, a passionate, emotional, social initiative designed to empower women to take charge of their heart health. The Go Red for Women movement harnesses the energy, passion, and power women have to band together and collectively wipe out heart disease. It challenges them to know their risk for heart disease and to take action to reduce risk. It also gives them the tools that they need to lead a healthy life. Today, 12 years after Go Red Women cause began, more than 2 million women have learned their personal risk of developing heart disease by taking the Go Red Heart Checkup. More than 900,000 women have joined the fight. Women who join Go Red for Women receive important information that allows them to take action to improve their health. For instance, Go Red women are more likely to follow their doctor's advice from losing weight to taking their medication. 91% of women involved in Go Red for Women visited their doctor in the last 12 months. 64% follow a regular exercise routine. 84% have talked to friends about their heart health. 90% of women have had their blood pressure checked in the last year, and 75% have had their cholesterol checked in the last year. All of those numbers equate to nearly 300 fewer women dying from heart disease and stroke each and every day. And cardiovascular disease death in women has decreased by more than 30% over the past 10 years because more women know the signs and symptoms, are taking action, and demanding that their hearts be noticed. So why are we here today? You are why. Albuquerque women and the families who love them are why. We have come together today to inspire lifestyle changes, to mobilize communities, and to save lives. That is the mission of the American Heart Association's Go Red for Women movement. And I am honored to be a part of it and to celebrate the heart health of New Mexican women and the power that we have to improve health. To further demonstrate how the American Heart Association is supporting the heart health of our community, it is my pleasure to welcome Julie Morgas Baca from the County of Bernalillo to share how they are celebrating the heart health of more than 2,500 Bernalillo County employees. Julie?
Thank you. Good afternoon, everybody. Happy to be here, and I see a lot of county employees out here this afternoon. And actually, they've been very supportive of me and trying to keep my blood pressure down. So thank you all for being here, and we all work together, and it's just a great organization, and I love working with Mayor Barry and with the city as well. We just try to kind of help each other, and again, I'm just happy to be a part of this initiative. As everybody knows, high blood pressure affects a lot of people, but nearly 80 million or 1 in 3 Americans, and it is a leading factor for heart disease and stroke. 45.9% or 36.7 million of those with high blood pressure are not controlled. The American Heart Association has an aggressive goal to move 13.4 million people to control by 2020. And they want to do this using the Check, Change, Control program. Check, Change, Control, and we'll call it CCC, is an evidence-based hypertension management program that utilizes online and offline components to empower participants to take ownership of their own cardiovascular health. This program has proven to reduce blood pressure in drastic measures. Just a 5 drop in systolic blood pressure can have life-saving results, including a 9% reduction in heart disease mortality, a 14% reduction in stroke mortality, and a 7% reduction in overall mortality. And I just want to say thank you so much to the Albuquerque American Heart Associations on their efforts to raise awareness and prevention, which is so critical. But really, I just want to say that we need each other. And once in a while, when you see your coworkers, and I think we all do this. I know we do this here in our office. If you see your coworker stressed out, male or female, tell them to go for a walk. Seriously, it really, really helps. Or talk to them, because stress will do it, and I think we all know that. But again, I applaud the American Heart Association, and we all need to do our part to tackle this huge monster, but I know together we can do it. So thank you all very much, and have a great weekend, everybody. Thanks.
Good morning. My name is Rochelle Spencer. I'm the administrator of the Heart Hospital of New Mexico at Lovelace Medical Center. Lovelace Health System is a proud supporter of the American Heart Association's Go Red for Women movement. Our commitment to heart health, along with the efforts of every single one of you out here today, will help move New Mexico towards becoming a healthier community, and one where the next generation will really understand the importance of leading a healthy lifestyle. You've heard mention today of our whys. Well, my why is our beautiful city, our community that we have here, and unfortunately, some of the outcomes that I witness every day in our hospitals when our families, our mothers, our daughters, our sisters don't really understand the importance of making their health a top priority. The Go Red for Women movement is about empowerment, and all of you here today should be empowered by first and foremost knowing that heart disease is the #1 killer of women in the U.S., and it kills more women than all forms of cancer combined. A lot of people don't know that. In fact, about 90% of all women have at least one risk factor for heart disease. But also be empowered by knowing that 80% of heart disease and stroke is preventable if we just learn to manage the risk factors that are under our control. And those are physical activity, our weight, diet, smoking, blood pressure, cholesterol, and diabetes. So if you're able to manage those 7 risk factors, that's 80% of the battle. So what action can you take that can have a profound impact on your future and the future of your families? Learn the symptoms of a heart attack and stroke. We have handouts here today that can help you do that, or you can go online to www.goredforwomen.org. Understand that there are risk factors that we can't control, like genetic history. So know your risk factors, your history, and talk with your physician about that. Schedule a Well Women exam today. Get a head to heart to toes checkup. It's very important. Become a grassroots advocate and help us make changes and influence public policy on the state and federal levels. To get involved, visit you'rethecure.org. And also, Follow Go Red for Women on social media. Don't forget to share your why and also your photos from today using the hashtag ABQGoRed. So now, ladies and gentlemen, I'm proud to introduce a huge supporter of the Go Red for Women movement, Mayor Richard J. Berry, who we are honored to welcome again to celebrate National Wear Red Day with us. I'd also like to welcome our First Lady, Maria Berry. Mayor Berry was first sworn into office on December 1st, 2009.
They know I'm the mayor. I'll be all right. Yeah,
You want me to skip all
my
that?
staff must have given that to you.
All right, well, we're really happy that he's here. So please help me welcome the Honorable Mayor Richard J. Berry.
Thanks so much.
Thank you so much. Yeah, I figured you knew I was a mayor by now, and our staff sends those out every time we do this. So, well, Julie, you'll be happy to know that already today my staff has told me to take a hike at least 3 times. So, thank you. That's our version of a rim shot at the city of Albuquerque. A couple people I want to thank. Certainly, the Heart Association, thank you so much for what you do. This is a big deal. And the fact that we've got a lot of our leaders here today from the Native American Women's Conference, thank you for joining us. Let's give them a big round of applause. Great job in leadership on this important. And Rostito Rojo is here as well, our Hispanic community. Where's those folks? Are they here today? Thank you for your leadership. So do me a favor, raise your hand if you or anybody in your family, any women in your family have ever been impacted by heart disease. To everybody. I lost my grandma when I was a kid to heart disease in Nebraska, and it made a profound impact on my life. She was the person that taught me to appreciate art. She was a ranch wife. Her and my grandfather had a ranch in Nebraska. But she taught me how to paint, and she taught me how to enjoy literature and listen to music, even out in the middle of the plains in a ranch house. And we lost her to heart disease. And so my whole life, I've thought about this issue because it's impacted someone near and dear to me. We know the statistics, and they're alarming, and that's the bad news. The good news is we can do something about it individually. I want to say a special thank you to Loveless. When we started our Step It Up campaign at the city of Albuquerque, Loveless was right there with us from the very beginning. They put money towards this. Let's give them a round of applause. They put money towards the program. We bought pedometers, we bought water bottles, we made people aware of that. And Step It Up is a simple program. It just means put on a pair of shoes and get out and do something. You don't have to do anything expensive. So we have our stairwells at City Hall now painted with our Step It Up campaign. We ask our employees to walk up and down the stairs. Of course, we have county employees there as well. We've walked, I don't know how many times we've walked to the moon and back on this program, but there's a website you can go to as well. The fact is we can do things about this. We can go to the doctor, we can get checked up, we can do the simple things that it takes to monitor our health, and that will make a huge difference. A couple more stats. In New Mexico, 30% of us have high blood pressure, 37% have high cholesterol. In Albuquerque, the numbers are very similar. So we're just asking people to do something, and that is 30 minutes a day. Just do something. Just get out and move. Funds raised by the Go Red for Women allow the American Heart Association to help us with education programs, increased awareness, support research. So please go out there and support the American Heart Association. I'm going to leave here today. I'm going to go to Santa Fe to testify in the committee on one of the bills that the city has. I guarantee you our legislators will be wearing the lapel pin. If they're not wearing a red tie today or a red dress, they'll be wearing the red lapel pin. So your legislators, I can tell you as a former 2-term state legislator, your legislators know about the issue. They care about the issue as well. So I'm going to save you the reading of a proclamation, but what I've done today is we have an executive order from the office of the mayor, which basically says today is National Wear Red Day in the city of Albuquerque. We do that because, as I said earlier, it's an important issue. It's an issue I care about as a mayor. The First Lady cares about it, and we've got tremendous leaders in our community that are going out there every day to help us get well, help us be in good health, and help us be there for our kids and our spouses and our grandchildren and all the things that we want to do in our lives. So thank you for being here today. I look forward to making our heart again. In the meantime, though, I want to introduce your First Lady. I think she wrote a poem actually for today. Thanks.
But it doesn't rhyme, okay? Thank you all for being here. This is a wonderful kickoff to Go Red for Women Month, and I wrote this short poem about the 1 out of 3 women that still dies of heart disease. It's called One More, One Less. One more woman that dies of heart disease is one less future president, Nobel Prize winner, astronaut, rocket scientist. One more woman that dies of heart disease is one less Olympic champion, entrepreneur, CEO, cardiac surgeon. But most of all, one more woman that dies of heart disease is one less mom. And that is one less shoulder to cry on, hand to hold, hug to give. One less grandma, daughter, sister, wife, and friend. So let's spend this month increasing awareness so we can have one more survivor and one less victim of heart disease. Let's go red.